Kidney stones are a painful condition and one of the most common disorders of the urinary tract. A technique called lithotripsy breaks these stones up so they can be passed more easily. Dr. Richard Holevas of Hoag Memorial Hospital Presbyterian in Newport Beach discusses the effectiveness of this treatment.
Lithotripsy is a technique of fragmenting kidney stones. It's used to treat stones that are in the upper or lower urinary tract. It's a technique that was developed as an advance over open surgery, which was used for years. The vast majority of patients with kidney stones are candidates for lithotripsy. There are certain stones which are going to have better results with lithotripsy than others. Size of the stone, location of the stone, relative hardness of the stone, these are all factors that the urologist will put into the decision-making process to see if it's going to be a stone candidate for the lithotripsy. The treatment involves an outpatient procedure where the stones are fragmented using shock waves. The shock waves can be generated on a number of different pieces of equipment. These shock waves will break the stone into small particles. The particles will then pass through the urinary system and out of the body. The treatment itself will take approximately an hour to an hour and a half. After a short period of recovery to make sure they can tolerate liquids, they're not having excessive discomfort, they can go home. At home, they have to just take it easy for a few days. Most patients will not need to be hospitalized. That would change, however, if you have a complicated stone, a person who has a transplanted or solitary kidney, someone who has an active infection or other complicating factors that might make the lithotripsy more dangerous. The advantages of lithotripsy primarily center on the outpatient nature of the treatment, minimizing trauma to the body and specifically the kidney, avoiding the need for an open surgical procedure, which years ago was the only avenue to treat stones that were in the upper urinary tract. So by minimizing these potential problems, you can treat patients, have them go home, resume activities in a rapid fashion. Some kidney stones can be prevented. Prevention strategies center primarily on maximizing fluid intake and then looking for either dietary or familial patterns or enzyme deficiencies or other medications patients might be taking that would predispose them to having higher levels of minerals that form stones. But across the board, the biggest single thing that someone can do who's had stones in the past is make sure that they're drinking enough fluids, particularly as we enter summer months and the weather gets hotter. I think someone who's looking for stone treatment, which includes lithotripsy and some of the other techniques, they're looking for a place that's going to have the latest in techniques, skilled personnel, and is experienced in dealing with the variety of options that are available for treating the stones. What someone wants is to be able to go in, have a single procedure, and have the highest success of being stone-free from that single procedure. Sometimes lithotripsy alone is the best choice, and sometimes you have to combine that in creative ways with other treatments. The nice thing about Hoag Hospital is all of the latest techniques are available here. The people here are trained at doing them. And so regardless of the stone composition, location, and complexity, we can deal with that stone, we can have them treated and get them out expeditiously and back to their normal life.